Welcome to our chapter on the skeletal system. The skeletal system is much more than just a rigid framework of bones. It's actually a dynamic and living structure essential for movement, support, and protection. As we go through this chapter, we will examine not only the bones themselves, but also the connective tissues that support and stabilize the skeleton, such as ligaments and cartilage. We'll also explore how bones grow, remodel, and repair throughout life, as well as structural organization of the skeleton into the axial and appendicular components. Additionally, we'll also highlight common disorders that affect the skeletal system and strategies for prevention and treatment. By the end of this chapter, you should understand how the skeletal system maintains balance between stability and flexibility, allowing the body to move while protecting vital organs. The skeletal system is made up of three primary connective tissues: bones, ligaments, and cartilage. Bone is the hard structure component that provides the framework and support for the body. Ligaments are bands of dense fibrous connective tissues that connect bones to another, stabilizing joints and ensuring proper alignment. Cartilage is a specialized connective tissue with collagen and elastic fibers in a gel-like ground substance. It plays a crucial role in cushioning the vertebra, absorbing shock, and reducing friction in joints, making smooth movement possible. Together, these three tissues balance strength and flexibility. Bone gives the rigidity and structure, ligaments provide stability, and cartilage adds cushioning and support under pressure. Bone appears rigid and lifeless, but is actually a living tissue. Its hardness comes from calcium mineral crystals embedded in their matrix, while its vitality comes from specialized cells that build, maintain, and remodel bone throughout life. Bones perform 5 vital functions. They support by creating a structural framework for the body, protection by shielding organs like the brain, heart, and lungs, movement by acting as levers for muscles, blood cell formation by producing red blood cells and white blood cells in the bone marrow, and mineral storage by serving as the reservoirs for calcium and phosphate. These minerals can be released into the blood when needed to maintain homeostasis. Without bones, our bodies could lack both structure and function, as bone provides the balance between rigidity and support and flexibility for movement. Although bones are rigid, they are alive with cellular activity. A long bone, such as the femur, has compact bone forming its shaft and ends with a central marrow cavity. This cavity contains yellow bone marrow, mostly fat, which stores energy. At the ends of the bones, there's spongy bone that provides a lattice-like support structure and contains spaces for red bone marrow. Red bone marrow is especially important because it houses stem cells that produce blood cells, including red blood cells for oxygen transport, white blood cells for immunity, and platelets for clotting. This dual design for compact and spongy bone allows bones to both be strong and relatively light. The balance of marrow types reflects changing needs. Children have more red bone marrow for support, rapid growth, and blood production, while adults have yellow bone marrow. Ligaments are strong, rope-like bands of dense fibrous connective tissue that connect bone to bone at joints. Their role is to stabilize joints by preventing excess movement, while still allowing enough mobility for more function. This balance between stability and flexibility is critical. Too much looseness in a ligament can lead to joint dislocations, while too much stiffness could limit motion. Ligaments are composed mostly of collagen fibers, giving them a tremendous strength but little elasticity, which is why they resist stretching. Once overstretched or torn, they heal slowly because of their limited blood supply. In human body, ligaments ensure that our skeletal system maintains proper alignment, even in complex movements like running, jumping, or lifting. They are especially important in high-stress joints such as the knee, where ligaments like the ACL and PCL maintain the stability required for weight-bearing and athletic activity. Cartilage is another connective tissue that provides flexibility and support under pressure. Unlike bone, cartilage lacks a direct blood supply, which explains why it heals slower than any other injury. There are 3 main types: fibrocartilage, hyaline, and elastic cartilage. Fibrocartilage is tough and found in intervertebral discs and menisci, where it absorbs shock and prevents bone-to-bone contact. Hyaline cartilage forms the embryonic skeleton later replaced by bone, and also covers the ends of long bones and joints to reduce friction. Elastic cartilage is found in the outer ear, nose, and epiglottis and adds flexibility while maintaining shape. Bone formation begins early in fetal life with cartilage models formed by chondroblasts. These cartilage templates serve as the framework for developing bone. As the fetus matures, osteoblasts replace the cartilage with bone tissue in a process known as ossification. Osteoblasts secrete osteoid, which is a protein-rich matrix that becomes mineralized with calcium phosphate, giving bone its rigidity. Over time, osteoblasts mature into osteocytes, which occupy the lacuna and maintain the surrounding bone matrix. This transition from flexible cartilage to rigid bone provides the developing body with both support and protection as it continues to grow. After birth, bones continue to lengthen and thicken, particularly during childhood and adolescence. This growth occurs at the epiphyseal plates, also known as growth plates, located near the ends of long bones. Chondroblasts actively produce cartilage as the outer surface of the plate, while osteoblasts replace the cartilage with bone at the inner surface. This process pushes the growth plates apart, lengthening the bone. At the same time, the bone grows in diameter as osteoblasts add new layers beneath the periosteum, strengthening the bone to support its increasing body weight. Growth continues until the plates eventually fuse during late adolescence or early adulthood, making the ends of longitudinal bones. Hormones, nutrients, and exercise all influence this process. Even after growth plates close, bones remain an active tissue, constantly undergoing remodeling. Remodeling involves both osteoblasts, which deposit new bone, and osteoclasts, which break down old bone. This process allows bone to change shape, size, and strengthen in response to stress. Weight-bearing exercises, for example, stimulates osteoblasts to increase bone density, while a sedentary lifestyle may lead to bone loss. Remodeling also ensures bone remains strong and free of microdamage, adapting to the body's need over time. Bone homeostasis depends on maintaining a delicate balance between osteoblast and osteoclast activity. Disruption to this balance can result in conditions like osteoporosis. Additionally, bone remodeling plays a role in repair after injury as damaged tissue is replaced with new bone. Bones adapt to stress through a process guided by electrical signals. Compressive stress, such as weight-bearing activities, generates tiny electrical currents in bones that stimulate osteoblasts to deposit more bone tissue. Areas of frequent stress grow stronger, while areas with little stress are absorbed by osteoclasts. This explains why athletes often develop denser bones and why individuals confined to bed rest may lose bone mass. Such remodeling ensures bones remain functional and efficient, adjusting the demand placed upon them. Weight-bearing exercise like walking, running, or resistance trainings are critical for maintaining healthy bones and its bone mass throughout the life. When remodeling becomes imbalanced, however, conditions such as osteoporosis may occur where bone reabsorption outpaces deposition. Hormones play a central role in regulating bone metabolism. Parathyroid hormone is secreted when blood calcium levels drop too low. Parathyroid hormone stimulates osteoclasts to release enzymes that dissolve bone tissues, releasing calcium into the bloodstream to restore balance. In contrast, calcitonin, secreted when blood calcium levels are too high, encourage osteoblasts to deposit calcium and phosphate into bones, strengthening the skeleton and lowering blood calcium levels. This hormonal feedback loop maintains calcium homeostasis, which is essential not only for bone health but also for nerve conduction, muscle contraction, and blood clotting. Without proper regulation, imbalances can lead to fragile bones or dangerous shifts in blood calciums. When a bone fractures, the body initiates a complex repair process. First, a hematoma forms at the fracture site, causing inflammation, swelling, and pain. Fibroblasts then migrate to the area and begin producing connective tissues, some differentiating into chondroblasts that form a fibrocartilage callus to stabilize the break. Osteoclasts clears away dead bone and hematoma remnants, while osteoblasts deposits new bone tissue, gradually replacing the callus. Over weeks to months, the fracture site strengthens as new bone fully integrates. Although the repaired bone may initially be thicker, remodeling eventually reshapes it to restore normal structure. The skeleton itself is composed of 206 bones that works together with connective tissues to form the body's structural framework. Bones are categorized into four main types. Long bones, such as those in the limbs and the fingers, designed for movement and leverage. Short bones, like those in the wrists, which provide stability and limited motion. Flat bones, including the cranial bones, the sternum and the ribs, which protect organs and offer broad surface for muscle attachments. And irregular bones, such as the coxal bone and vertebra, which has specialized shapes for unique functions. Together, these bones protect organs, enable movement, and restore minerals, while also producing blood cells in the marrow. The skeletal system is essential for three broad functions: protection, support, and movement. It provides structural support for soft tissues and organs, ensuring the body maintains shape and posture. Protection is another vital role, with the cranium shielding the brain and ribcage surrounding the heart and lungs, and the vertebral column encasing the spinal cord. The skeleton also makes movement possible by serving as the framework for muscle attachment. Joints allow bones to articulate, giving the body flexibility and a wide range of motion. This integration of bone, muscle, and joints creates a coordinated system that enables walking, running, lifting, and countless other activities. The human skeleton is divided into two main parts: the axial skeleton and the appendicular skeleton. The axial skeleton forms the central axis of the body and includes the skull, sternum, and ribs, as well as the vertebral column. Its primary functions are to protect vital organs such as the brain, heart, and lungs, and support the body's upright posture. The appendicular skeleton consists of the appendages, which are the arms and the legs, and their attachment structures, the pectoral and pelvic girdles. These bones allow for the movement and interactions with the environment, providing the leverage muscles needed for locomotion and manipulation. The distinction between axial and appendicular skeleton highlights how the body is organized, structured to function. The axial skeleton forms the body's midline and includes the skull, vertebral column, ribs, and sternum. The skull is composed of the cranial and facial bones, which enclose the brain and supports the structures of the face. The hyoid bone, located in the upper neck, is unique because it does not articulate with any other bone. Instead, it's suspended by muscles and ligaments and serve as the anchor for the tongue, larynx, and pharynx. The vertebral column is composed of 33 irregularly shaped bones divided into cervical, thoracic, lumbar, sacral, and coccygeal regions. It encases the spinal cord and allows flexibility for bending and rotation. The ribs attach to the thoracic vertebra and curve forward to join the sternum, forming the rib cage. This bony cage protects vital thoracic organs such as the heart and the lungs and provides a framework for muscles involved in respiration. Cranial bones are flat bones that form the protective case that surrounds the brain. The frontal bone shapes the forehead and upper eye sockets. The parietal bone forms the roof and upper sides of the cranium. The temporal bones, located near the ears, contain structures of hearing and balance. The sphenoid bone spans across the skull's base and connects with nearly every other cranial bone, contributing to the orbits and the floor of the cranial cavity. The ethmoid bone is positioned between the eyes and supports the nasal cavity while helping form the medial walls of the orbit. At the posterior skull, the occipital bone provides protection for the brainstem and cerebrum. Within the occipital bone lies the foramen magnum, a large opening through which the spinal cord connects to the brain. These bones are joined together by immovable fibrous joints called sutures that lock in tightly in place. Facial bones create the framework for the face, housing the organs of special senses, and providing attachment points for muscles for facial expression and chewing. The maxilla forms the upper jaw, containing the sockets for upper teeth, and contribute to the nasal cavity and orbits. The mandible, or lower jaw, is the largest and only movable bone in the skull, making it crucial for speech and mastication. The zygomatic bone forms the cheek prominence and lateral walls of the orbits. The nasal bone creates a bridge of the nose, while the lacrimal bone contains openings for the tear ducts. The palatine bone forms part of the hard palate, and the vomer contributes to the nasal septum. Several facial and cranial bones contain sinuses, which are air-filled cavities that lighten the skull and improve resonance of voice. These bones work together to support vital functions like eating, breathing, and sensory perception. The hyoid bone is a small U-shaped structure located in the anterior neck below the mandible. It does not directly articulate with any other bone, but it is held in place by a network of muscles and ligaments. This unique positioning makes it an anchor for the muscles of the tongue, larynx, and pharynx. These attachments allow the hyoid to play an essential role in swallowing, speech production, and maintaining an open airway. Movement of the hyoid bone influence the position of the larynx and contribute to the mechanics of phonation. Because it is suspended and relatively delicate, the hyoid bone is rarely fractured, except under forceful trauma such as strangulation. For this reason, examination of the bone is an important part of forensic investigation in cases of suspected homicide. The bone's small size belies its critical role in the complex interactions of muscular and skeletal systems in the neck. The vertebral column or spine is composed of 33 vertebrae divided into cervical, thoracic, lumbar, sacral, and coccygeal regions. The cervical region consists of 7 vertebrae, including the atlas and axis, which allows the head rotation and nodding. The thoracic region contains 12 vertebrae, each articulating with pairs of ribs to form the rib cage. The lumbar region, with 5 large vertebrae, support most of the body's weight. The sacrum is made up of 5 fused vertebrae that connect with the pelvis, and the coccyx is fused of 4 small vertebrae forming the tailbone. Intervertebral discs of fibrocartilage separate adjacent vertebrae, providing cushioning, shock absorption, and flexibility. The vertebral column not only protects the spinal cord, but also serves as the central support for posture, allowing bending, twisting, and weight transfer from the upper body to the pelvis and lower limbs. The vertebral column can suffer injuries that affect both the bony structures and the spinal cord. One common problem is a herniated disc, which also known as a slip disc. This occurs when an intervertebral disc bulges outwards, often due to sudden movements or impacts, and compresses nearby spinal nerves. Pressure on these nerves can cause pain, numbness, or weakness along the affected pathway. In severe cases, the disc may be ruptured, releasing its inner material and worsening nerve compression. Surgical procedures may relieve pressure but can reduce flexibility in the spine. Injury to the vertebral column can also carry the risk of damaging the spinal cord, which can result in partial or complete paralysis depending on the level and severity of the injury. Trauma to the cervical region is particularly dangerous because it can impair breathing and vital organ control, making spinal injuries some of the most critical medical emergencies. The rib cage consists of the sternum at the front and the 12 pair of ribs that extend from the thoracic vertebra. 10 pair connect both to the spine and to the sternum through the costal cartilage, creating a protective cage around the lungs and the heart. The lowest 2 pairs are known as floating ribs because they attach only to the vertebra and not to the sternum. The sternum or breastbone lies at the center of the chest and serve as the key protective structures of the heart. The rib cage is flexible due to the cartilage connections, allowing for expansion and contraction during breathing. Injuries to the ribs or sternum can compromise this flexibility, making respiration painful or inefficient. The structures of the rib cage demonstrates how bones and cartilage work together to provide both strength and mobility, ensuring the vital organs of the thoracic cavity are protected while respiration remains possible. The appendicular skeleton includes all bones of the limbs and the girdles that attach them to the axial skeleton. In the upper body, this means the clavicles and the scapulas, which form the pectoral girdle, as well as the bones of the arms, wrists, and hands. In the lower body, it includes the pelvic girdle and the bones of the legs, ankles, and feet. These structures provide the mobility needed to interact with the environment, carry out locomotion, and manipulate objects. The appendicular skeleton also allows humans to perform fine motor tasks such as writing or tool use, while supporting the body's weight during walking and running. The pectoral girdle, consisting of the clavicles, the scapulas, provide attachment for the upper limbs. The clavicle or collarbone connects the scapula to the sternum, stabilizing the shoulder region. The scapulas or shoulder blades are flat bones that allow for a wide range of motion at the shoulder joint. The humerus forms the upper and arm and articulates with both the scapula and the shoulder, and the radius and ulna at the elbow. The forearm contains its two bones, the radius, which is located on the thumb side, and the ulna, which lies on the finger side. The wrist contains 8 small carpal bones, and hand contains 5 metacarpal bones, and fingers and thumbs together have 14 phalanges. This arrangement permits incredible dexterity, allowing the hands to grip, manipulate, and perform delicate tasks, also while being capable of powerful movements required for lifting and pushing. The pectoral girdle structure provides an exceptional range of motion for upper limbs. Unlike the pelvic girdle, which is tightly bound for weight support, the pectoral girdle is connected to the axial skeleton mainly through muscles and tendons, allowing greater mobility. This design enables the arms to rotate nearly 360 degrees and perform complex movements such as throwing, climbing, and lifting. The elbow joint permits both bending and rotational motions, while the wrists and fingers add further flexibility. The opposable thumb is especially important for grasping and manipulating objects, a feature central to human evolution and tool use. However, the flexibility comes with a cost, making the shoulder joint particularly prone to dislocations and injuries. Common problems include broken clavicles, which are frequent fractures, and repetitive stress injuries like carpal tunnel syndrome, which affect the median nerve in the wrist and impairs hand function. The pelvic girdle forms the base of the appendicular skeleton and is composed of 2 coxal bones, the sacrum and the pubic symphysis. It supports the weight of the upper body and transfers the load to the lower limbs, making it essential for standing, walking, and running. The pelvic girdle also protects organs within the pelvic cavity, including parts of the digestive, urinary, and reproductive systems. Each coxa bone forms from 3 fused bones, the ilium, the ischium, and the pubis, that meet at the hip socket, or acetabulum, where the femur articulates. The femur, which is the largest and strongest bone in the body, makes up the upper leg. The patella or kneecap protects the knee joint. The tibia and fibula form the lower leg, with the tibia bearing most of the body's weight. The ankle consists of 7 tarsal bones. The foot has 5 metatarsals, and the toes include 14 phalanges, together enabling balance and locomotion. The pelvic girdle differs significantly between males and females, reflecting adaptations for childbirth. In females, hormonal influences during puberty remodel the pelvis to become broader and shallower, with a wider pelvic inlet and outlet. This structural adaptation allows for the passage of the fetus during childbirth. The pubic arch in females forms a wider angle, typically greater than 90 degrees, compared to the narrow angle in males. The sacrum in females is shorter and less curved, providing additional space for the pelvic cavity. In contrast, the male pelvis is more robust, with thicker bones and deeper cavities designed for strength and stability rather than childbirth. These anatomical differences can be identified during skeletal analysis and often used in forensic anthropology to determine biological sex. Joints or articulations are the points where bones meet, and they vary widely in structure and mobility. Some joints are immovable, such as sutures in the skull, where bones are fused for stability and protection. Others are slightly movable, like cartilaginous joints between vertebrae, and provide flexibility while maintaining strength. The most versatile are the synovial joints, which are freely movable and surrounded by a fluid-filled cavity. These joints are reinforced by ligaments and lined with synovial membranes that secrete synovial fluid, lubricating the joints and reducing friction. Articulating surfaces of bones are covered by hyaline cartilage, which act as cushioning to absorb the impact. The type of joint determines the range of motion, from hinge joints like the knee to the ball and socket joints like the hip and shoulder. Joints enable the skeleton to function as dynamic systems capable of movement and adaptation. At birth, the bones of the skull are not fully fused. Instead, flat bones are separated by soft areas filled with a fibrous connective tissue known as fontanelles or soft spots. These fontanelles provide flexibility during childbirth, allowing the infant's skull to compress slightly as it passes through the birth canal. They also permit rapid growth in early life. Over time, the fibrous tissues ossifies and the fontanelles close, leaving behind sutures, which are thin movable lines where bones have fused. In adults, these sutures firmly lock the cranial bones together, offering maximum protection of the brain. The presence and closures of the fontanelles are important clinical indicators of normal growth and development in infants. Pediatricians often check the size and tension of the fontanelles during examinations, as abnormalities can signal developmental or health concerns such as increased intracranial pressure or delayed ossification. Synovial joints are the most common type of joint in the body and allow the widest range of motion. Bones within these joints are separated by a synovial cavity filled with synovial fluid, which act as lubricants to reduce friction during movement. The inner lining of the cavity and synovial membranes produces this fluid. Surrounding the joint is a fibrous capsule reinforced by ligaments that provide stability while permitting flexibility. The ends of the bones are covered with a hyaline cartilage, which cushion and absorb shock, preventing wear from the repeated motion. Synovial joints include various types such as hinge joints that allow movement in a single plane, and ball and socket joints that permit rotation and multidirectional movement. Additional structures like bursa, which are fluid-filled sacs, and menisci, which are cartilage pads, enhances cushioning to distribute forces evenly across the joint. Synovial joints are classified by the type of movement they allow. Hinge joints like those in the knee and elbow allow movement and motion in a single plane, functioning like a door hinge. The knee contains additional features including menisci, which are pads of fibrocartilage that help stabilize the joint and reduce friction, and bursa, which are small fluid-filled sacs that cushion the movement. Ligaments such as the anterior and posterior cruciate ligament, ACL and PCL, provide stability for preventing excessive motion. Ball and socket joints such as the shoulder and hip permit movement in multiple planes, including rotation, making them the most flexible type of joint. Their design allows for a wide range of motion that makes them more vulnerable to dislocation or injury. Joints rely on more than bones to maintain stability and function. Ligaments composed of tough connective tissue rich in collagen fibers connects bones to bones and reinforce synovial joints. They limit excessive movement and prevent dislocation. Tendons attach muscles to bone, transmitting the force generated by muscle contractions to create motion. A well-known example is the Achilles tendon, which connects the calf muscle to the heel bone, enabling walking, running, and jumping. Both ligaments and tendons heal slower due after injury because of their limited blood supply, making recovery long and often incomplete. Muscles surrounding the joints provides additional dynamic stability by adjusting tension as movement occurs. For example, the rotator cuff muscle stabilizes the shoulder joint during arm movements. Together, ligaments, tendons, and muscles form an integrated support system that allows joints to maintain mobility, yet strong enough under constant mechanical stress. The skeletal system is subject to several common disorders that affect bones, joints, and connective tissues. Sprains occur when ligaments are stretched or torn, often in the ankle, and heal slowly due to poor blood supply. Bursitis and tendinitis involves inflammation of bursa or tendons, typically from repetitive motion or trauma, leading to pain, swelling, and reduced mobility. Osteoporosis is a widespread disorder marked by excessive bone loss, where bones become brittle and fragile and fracture easily. Arthritis refers to inflammation of the joints and come in several forms. Osteoarthritis results from wear and tear that erodes cartilage, while rheumatoid arthritis is an autoimmune condition in which the immune system attacks joints, tissues, causing chronic pain or deformity. A sprain is the stretching or tearing of ligaments, the tough connective tissue that stabilizes joints. Symptoms include pain, swelling, and bruising at the site of injury. Ankle sprains are amongst the most common, often caused by sudden twisting or rolling motion. Because ligaments contain few cells that have limited blood supply, sprains heal slowly compared to other soft tissue injuries. In mild cases, rest and supportive care may be sufficient, but severe sprains involving complete ligament tears may require surgical repair. A torn ACL in the knee is a classic example, often repaired using a tendon graft to restore stability. Rehabilitation is essential to regain strength and prevent recurrent injury. Sprains can range in severity from mild outstretching to complete rupture, and athletes are especially prone to these injuries due to the high mechanical demand placed on their joints. Bursitis and tendinitis are painful conditions involving inflammation of the connective tissues that surround the joint. Bursitis affects bursa, which are small sacs filled with fluid that cushion movement between bones, tendons, and muscles. Tendinitis is the inflammation of tendons, which are collagen-rich cords that connect muscles to bone. Both conditions may result from repetitive stress, overuse, or sudden trauma. Symptoms include localized pain, warmth and swelling, and restricted motion. The common sites include the shoulder, elbow, knee, and Achilles tendon. For example, tennis elbow is a form of tendinitis resulting from repetitive strain on the forearm muscles and tendons. Because of limited blood supply, the tendons and bursa healing is slow, and rest combined with anti-inflammatory treatment is often required. Chronic cases may lead to tissue degeneration or rupture, further limiting the mobility and function. Osteoporosis is a disorder in which bones lose mass and density, becoming brittle and fragile. This condition results from an imbalance between osteoclast activity, which breaks down bone, and osteoblast activity, which builds bone. Beginning around age 35, both men and women eventually lose bone mass, but women experience a faster rate, especially after menopause, when estrogen levels drop. Men typically lose about 0.4% of bone mass per year, while postmenopausal women lose 2 to 3% annually. Osteoporosis greatly increases the risk of fractures, particularly in the spine and the hip, which can have life-altering consequences. Risk factors include inadequate calcium or vitamin D intake, sedentary lifestyles, smoking, being underweight, and certain medical conditions or medications. Prevention of osteoporosis begins early in life by ensuring sufficient calcium and vitamin D intake, which are essential for bone mineralization. Weight-bearing exercises such as walking, running, and resistance training help maintain bone density by stimulating osteoblast activity. Strength training in particular increases both muscle and bone strength, reducing fracture risks. For those already affected, treatments include medications that inhibit osteoclast activity such as biphosphonates, which slow bone breakdown. Other drugs like Forteo and Tymlos act by stimulating osteoblasts to promote new bone formation. Hormonal therapies may also be considered for postmenopausal women to slow bone loss. Lifestyle medications and modifications include smoking cessation and limited alcohol, further contributing to maintaining bone strength. Regular bone density scans helps identify individuals at risk and allow the early intervention before severe bone loss or fractures occur. Arthritis refers to the inflammation of joints and is one of the most common causes of chronic pain and disability. Osteoarthritis is the most prevalent form, resulting from wear and tear that gradually erodes the cartilage covering the bone. As cartilage thins, bones rub against each other, producing pain, swelling, and stiffness, and reduced mobility. Treatments include nonsteroidal anti-inflammatory drugs, injections of hyaluronic acid to improve lubrication, regular exercise, and in severe cases, surgical joint replacement. Rheumatoid arthritis differs in being an autoimmune disease in which the body's immune system attacks its own joints, tissues leading to chronic inflammation, joint deformities, and systemic symptoms such as fatigue. Like osteoporosis, which develops gradually with aging and body activity, rheumatoid arthritis can appear at young ages and progress unpredictably. Both forms severely impact quality of life and require careful management with a combination of modifications, including medications, therapy, and lifestyle adjustments.